Ladies and gentlemen, welcome to Blood Health Matters. This is a podcast where I have deep conversations with doctors, which is going to help you gather more knowledge about your blood health, how exactly you can make changes to your day-to-day to achieve a better, a healthier lifestyle, and most importantly, gathering more knowledge and awareness about things that all of us need to know about. Today, we're going to be sitting down with Dr. Sharat Damodar, who's had more than 25 years of experience in this particular field. So just sit back, relax, and listen to every single word that this genius has to say. Welcome back, doctor. This is episode 2 and we're going to be talking about blood-related disorders. Now, the internet, I feel it's created a very big lapse, especially because information is so easily available, it's very difficult to decipher what is right and what is wrong, especially with a lot of WhatsApp forwards that are happening these days. My father is a very big fan of it, and I am not, honestly, because my father loves to forward anything and everything he gets on his WhatsApp groups, and half of the time, it's not even real. So, through this episode, I genuinely want that everyone gets not just a basic, but a very personalized sense of awareness about blood-related disorders. Because I feel awareness is very important for someone to at least start caring about themselves and start making amends in their lives. So, the first question for you. When people hear blood disorders, what conditions does it actually include, if in adults we're talking about?
Right. So like I mentioned, there are 3 components in blood, right? So red cell, white cell and platelet. Usually when you talk about blood disorder, you're talking about a problem with any of these 3 components. So anemia, I already discussed with you, low hemoglobin. We spoke about iron and vitamin deficiency, which is the commonest thing. The white cell, is required to fight infection. If your white cell count drops for any reason, where there's a production problem in the bone marrow, then it's called aplastic anemia, which is a serious life-threatening disorder where you're not able to fight infection and it can become life-threatening. Similarly, if there's excess production of white cells, there are uncontrolled proliferation, then that's something called which is cancerous. So cancer is basically excessive proliferation of these abnormal cells, and that's the biggest fear which everybody has. Whenever we talk blood disorders, most people will equate it to blood cancer. Okay, even when the platelet count drops, there are a lot of reasons for that. It would be sometime because of drug, dengue, some viral fever. The first fear is, doctor, do I have blood cancer? Okay, because earlier days, blood cancer meant death sentence. Very clear. Yeah. We've got enough of movies which have used this.
Very true.
Anand, you got, So, Amitabh and Rajesh Khanna's, lymphosarcoma of the intestine. Okay. The Kannada movies have used this. You give somebody blood cancer, end of story.
Yep.
Okay. So that was what was the situation 20 years ago. But in today's world, you can cure blood cancer. And thereby, there are newer treatments.
Okay.
Since you mentioned WhatsApp, there was a forward going around, quite some time. There is this drug which cures blood cancer. Went around for years together. Just like the Russian vaccine which cures all cancer. Yeah, okay. Forwards going around. So that obviously is not fully true. So that was a drug called imatinib, which is a drug used in chronic myeloid leukemia, which is a low-grade blood cancer. Because of the discovery of why that cancer developed, there's a mutation which happens. You have a drug which can target that, and that drug, you can actually cure that disease.
Wow.
It's like diabetes, you first just took it for years together. Now we can even stop the drug and people are well.
Wow.
Okay. So this is what has happened in advancement or treatment of some of these disorders. Okay. So with more and more such research and development going on, people are able to say, why does some cell become cancerous? Because it's excessively proliferating.
Right.
And your normal cell, which should have killed it off and kept it under control, is not working. So it's a little, excess here and a deficiency of immune system.
Very true.
So if you can balance this out, then you can just get the good fellow again to kill off the bad fellow. Okay, so that's where we are all kind of working towards.
That's wonderful.
Okay? So that's just a gist of what people talk about when we talk about blood disorders. But like I mentioned, we should also remember that in the blood, we've also got, platelets, cholesterol, all of that is all your blood tests are done because it's monitoring things in the blood. Yeah. And if there's a problem there, your sugars are high, your cholesterol is high, your creatinine is high, your kidney is affected, liver has a problem, all of that you're picking up on those blood tests. So it tells you more than just a blood-related problem.
Right.
That's the advantage of doing that, and which is why we advocate doing some of these tests on a regular basis.
Wonderful. Now that you're talking about it, what are some common blood disorders for people to know that are frequently seen but ignored, unseen? People might not know about it or people ignore it for a lot of time. So
so that's why I said when you do this annual health checkup and everybody does these blood tests, please get it reviewed by at least your family physician so that he looks at it. And parameters which are out of range should be addressed.
Right.
So if your hemoglobin is low, it's good to find out what is the reason for it and treat it. If your platelet is low or high sometimes, I've seen that, getting ignored. If your platelet goes on increasing, then you have a higher risk of clotting. Okay. And then the fellow then comes with a stroke, and then you realize that he's been having this problem for quite some time.
Right.
Okay. So small little tweaks, if it's abnormal, it should be addressed by the physician so that we can sort that out early.
Right.
Clearly, an extreme form of that would be blood cancer, which anybody would straight away pick up and tell you to immediately go to a hospital and
Yes.
sit on it.
Wonderful. If we're talking about it, what are some early signs or symptoms that if a person spots in their own cells, in their daily lifestyle, which should tell them that, okay, now I should go and get tested?
Yeah. So commonest symptom is weight loss. So whenever somebody has disproportionate weight loss,
Right.
and what might have eating well.
Proportion as well.
So 10% of your weight in about 6 months' time.
Okay.
Yeah. Okay. So if you lose at least 10% of your weight in 6 months, that's significant weight loss without an effort to lose it. So you're not dieting, exercising, and then.
Right.
So it's not deliberate.
Right.
You're eating just as well. You're doing or not doing whatever you were doing, and you still lose weight.
Right.
Then it's significant. In our country, tuberculosis and cancer is something which will flag the moment you have weight loss. So we would never ignore that.
Got it.
Got it. Prolonged fevers going beyond 2 weeks. Okay. So everybody gets viral fevers, sore throat here and there. Most of the time, 3 to 5 days of fever and settles down. If you've got a fever going more than 2 weeks, don't ignore, go and get it looked at. Okay.
Got it.
Second is symptoms of fatigue. You climb a flight of stairs, you're getting breathless. You could earlier run up 5 flights of stairs. Now you climb 1 flight of stairs and then you're getting breathless.
Right.
Don't ignore.
Right.
Get that addressed. If you notice bleeding from the nose, bleeding while brushing,
Right.
or spots on the body, which is typically, indications of, low platelet,
Yes.
then that should be checked. So these are small little signs and symptoms which you can pick up and get it looked at.
Wonderful. So to summarize for the audience, you mentioned disproportionate weight loss, which is 10% of your body weight in 6 months without you making any extra efforts for it.
Correct.
Then prolonged fevers, fatigue, and bleeding. These are some symptoms that if you notice in your daily lifestyle, you must get it checked.
Yes.
I'm sure we're scaring a lot of people. So I also want you to tell them that, of course, blood disorders, they are serious, but they can be cured.
Yes. Yes.
Lovely. All right. So in this process, how important are routine blood checks in the lives of the people who are watching? So like how often should these people get their blood checked, or when should they do it for that sake? I'm sure like once you've mentioned these symptoms, these are non-negotiables. Like if you notice them in your life, of course you should go and get your blood tests.
Absolutely.
But is a routine blood health checkup also recommended? If yes, how often should one do it?
So this is a kind of a double-edged question, because I've had people who've said that, 1 month back I went and did a health checkup and came and I was absolutely normal.
Yeah.
And then a month later I'm coming and seeing you and now you're telling me my WBC is very high and my platelet is dropped. Okay, how is this possible?
Yeah.
Unfortunately, leukemia can present that like that, that quickly. In 2 to 4 weeks you can have a problem.
Right.
So because of that, I cannot tell them you keep checking blood every month.
Right.
It doesn't make sense.
Right.
So we still go by the fact that once a year, do an annual health checkup, which is your general whole body checkup, which includes blood tests. If something flags there, certainly get it addressed. But if any of the other symptoms what we mentioned, do it early. So that's the bottom line. Because you can't go on testing just for this, fact that you'll, want to pick up something early. So don't ignore symptoms. But otherwise, an annual health checkup is something which is recommended.
Wonderful. I'm sure the audience will have a lot to take away from this particular episode. Thank you so much, sir. That's a lot of awareness, a lot of knowledge for people. Make sure you're getting your annual health checkups done. And if you have any of the symptoms that were mentioned in this particular episode, it's a non-negotiable for you to go and get your health checkup done. Thank you so much, sir.